Welcome to the Ellis Medicine Family Medicine Residency Program brief tour. This is typically, just to give you some history, was given as a presentation when we would have in-person interviews in the morning of. This is not meant in any way to replace the interview or any of the open houses that we are doing, etc., but it's really just to give you some insight and some highlights of the program. And it may actually foster more questions than actually answer them for you. So let's get started. I think it's always best to start with the mission statement. It gives us something to ground us when all of the distractions kind of creep in our case. I think it speaks to making our clinic the curriculum, which you may see as you start looking out in family medicine programs and what they are trying to do and what the vision of that program is. We're lucky that in this case our mission statement had already included what it did to address both our residency needs as well as what our community needs may be. Our training takes place across these campuses of Ellis Medicine. I'll bring your attention to the top right corner there, the Ellis Health Center, which to me is kind of our home base, if you think of it that way, because that's where our family health center resides. With that being said, each of the campuses of both Bellevue as well as Ellis Hospital that you see there are about 5 and 7 minutes drive respectively from this home base. Clifton Park is an area that we do our emergency medicine in addition to what we do at the Ellis Hospital main campus, but that's about a 20-minute drive or so from here. That's a freestanding emergency medicine site. Some of the highlights of the program: we are a single program site, as you can see. We've been that way since 1977, and that is something that I think, when you consider the longevity and the relationships that are built over time in this community-based setting, is a real plus for us. We have a very diverse patient population, which I think lends to diverse pathology that you'll see over time here, and something that, again, I think becomes one of the highlights for us and a strength. We also have a surgical obstetrics fellowship. This is a one-year program after residency. This is not required, nor is it required if you said, you know, I'd really like to do maternity care after I finish up here. You can certainly do obstetrics with your training that you'll receive here through Ellis Medicine. However, if you decided that you wanted to be trained in C-section and needed that for any number of purposes, let's say from a global health standpoint or from a rural standpoint, or you're in a critical access hospital area with no backup, close by, then I would implore you to consider doing an OB fellowship with us in terms of learning surgical obstetrics. There's also a right of first refusal when it comes to this fellowship, meaning that we offer this first and foremost to our residents who are interested before we open it up to anyone else on the outside. I can certainly answer these in more detail or have you speak to our OB fellowship director as well. We also have a very active HIV and Hep C teaching portion to our program, which I think speaks to not only the full scope of training that you'll see here, but also to what we recognized as needs in our community. We're lucky enough to have a couple of faculty members who are becoming expert on this. There's always been this approach to allowing you to define your curriculum emphasis if you wanted to with your electives, and that's something that I think the ACGME is looking at as we move forward with potential changes to curriculum as they come up. Currently there is an elective in the first year that you receive as well as an elective in the second year, the remainder of which happens in your third year. And lastly, we do have a lot of support for research and scholarly activity. It's something that we require and have always felt strongly about. Again, I can speak to a little bit more detail on that if you have an interest. This is Ellis Hospital and the main campus of Ellis Hospital. This resides about 1.5 miles from our base campus of the McClellan campus, where our family health center is located. It's about a 5-minute drive away. What you'll be doing here at Ellis Hospital main campus includes your medical, surgical, ICU, ER rotations. We have both inpatient psychiatry for adults and pediatrics, and any of these subspecialty experiences that you'd have through your residency would take place through this campus. When you come to Bellevue, you're looking probably at about a 7-minute drive away, give or take a minute or two. It's about 2.5 miles from our main campus here in McClellan. When you think about what it is you'd be doing through Bellevue and what that would entail in terms of your training, I think of the who and the what of Bellevue. The who is those that you'll be working with from a women's health standpoint. So our OB laborists, our OB fellow, midwives, private practice, and community groups that you see, as well as our family medicine faculty and fellow residents. We have a NICU there as well, which is staffed by 3 neonatologists that you work with directly. Deliveries anywhere from 21 to 2,400 a year. I don't want you to think that that number at the bottom where it says total FHC only deliveries are the sole number that you'd be involved with. You guys make up a very good part of those total deliveries as more and more practices involve you in their care. However, if you were to look at how many women we bring through our FHC and deliver at Bellevue, it's somewhere in the range of 240 to 250 patients a year. This brings us to home base, as I keep saying. This is McClellan campus and the site of where our Family Health Center is. Within the Family Health Center, you're broken down into teams. You tend to start on a team and finish with that team over the course of your 3 years of residency. The supervising doctor for that team tends to be your advisor, but it's not always the case. However, we do not move you around from team to team to follow anybody. We move patients if need be to balance out panels, but you'll stay with your team all along. There's about 30 exam rooms here. We have minor surgery rooms. We have preceptor space, resident workspace. We have our own dedicated conference room for didactics. And what it is we offer through our Family Health Center is truly full spectrum family medicine care. You could see that we have specialty clinics, minor surgery clinics. We do our own colposcopy. We do our own IUDs, Nexplanons. We have a point of care ultrasound curriculum that we're rolling through, as well as I mentioned, that HIV and hepatitis care. Giving you as much as a broad spectrum of care that we can is the goal. I would be remiss if I didn't speak on the impact of the COVID pandemic. I know that we're not alone in that. I think it's been evident how much of an impact this has had, not just on those who are educating, but also those who are receiving that education. And I know I'm probably preaching to the choir here. I think what it did tell us, though, over time was that it truly did take a village. There were a number of groups and folks who had to come together and figure something out, especially with a novel virus. It took a lot to have to turn to our residents at times and admit we don't know yet about the impact or what this will do for you. What our residents did, however, do was pretty remarkable. The residency was involved in the first surge planning that took place within the hospital. Our residents were involved with helping to staff COVID units. They stepped in for folks who started to see impacts on their own staffing when it comes to providers that were afflicted. We also were out at community testing sites, as you can see here in this picture, across all of Schenectady, and did that with county health involvement to find areas that were difficult for patients to access testing sites. We just brought the testing to them. In addition, we also set up what was called fever clinic. This was to keep numbers down in the emergency department and keep people out of offices if there was a suspicion for COVID. But when you think about, well, were there negative impacts? Of course there were. There were things that from the standpoint of staffing within offices or rotations that were impacted that we're still climbing out of, and I think most places are across the country still trying to shake that off and move forward. The positive impacts were, pretty remarkable. Things like telemedicine that were on the back burner to roll out became first and foremost and paramount. I think people learned a lot about, staying calm and working with other players through a novel virus or outbreak. I think there was benefit to learning about our own, hampering thoughts about what we would do when rolling something out, and disaster planning and how that changed. And what we're doing now, I think, is really trying to kind of climb out from under that and get back some of the rotations and some of the experiences that we thought were impacted the most. In our own FHC, for example, I think lastly, we're working in a partnership with new administrative players, trying to bolster our staff, turn the focus more to resident needs, and improve upon workflows that, really showed us the best output in terms of our telehealth, and rebuilding those rotations, as I mentioned. Now, I think, people could say, well, you're talking about these strengths and these highlights of the program. What would you say is the biggest strength of the program? And I would still tell you the best thing about this program and this residency are the residents who are in it. These folks challenge us both personally and professionally in the best of ways. We are diverse when you look at our program, I think, across the board, and you'll see that about us on the whole. I think that's a strength. As you look across first year to second year to third year, you'll see we are definitely not a homogenous group at all. I think you'll notice, there's, as you get to learn about us, there's these different backgrounds and religions and races and sexual orientation and educational experiences and beliefs, and yet one of the more strong, consistent feedback items that we get from students who rotate through with us is how well our residents support and kind of feed off each other and gel together. And I think that's a big testament to them as individuals and hopefully to what we're trying to create in terms of environment. And I would just finish by saying, this is an amazing group of individuals that I'm indebted to have here, and for all that I get to learn from them as well. And if you ask me in, secret with, our own interview, I'm still going to tell you that the residents are what make this program strong. I had mentioned a little bit about the Surgical Obstetrics Fellowship earlier. We've been at this now for a number of years, over a decade, I believe, and we're turning out docs who go into different areas. We've got them in teaching institutions, we've got them in rural areas, we have them in critical access hospitals, and we have 2 of them on our own staff right now and 1 in our medical group. Again, I would like to just say that this does not mean that if you wanted to do OB that you could not do this without this fellowship. You could. But if you're looking to get trained in C-section, this is something that I think is really a nice opportunity for you, and I'm much more happy to continue speaking on this if somebody had a specific interest. Well, when you get to this faculty, you'll also note that we're a pretty diverse faculty. We bring different skill sets to the table. I'm truly lucky, or cursed depending on the day, how you look at this, with this faculty in this group who I really do love and admire. All of us here, with the exception of one person all the way back there in the corner, is Dr. Ansel, who's our behavioral psychologist. Otherwise, everybody here in this picture does outpatient family medicine with you. A few of them doing OB, 2 of them doing C-sections. If you break us down in terms of allopathic and osteopathic, we are 5 allopathic and 4 osteopathic physicians. I can give you each of their names and some interesting tidbits about them, but I'll hold that till interview day if that's okay. I share this slide with you, and I always hate to put a little disclaimer like a corporation trying to get something in under the wire there that this curriculum is subject to change. But right now, as we speak, this recording was done in September, and I can tell you that we are waiting to see what the ACGME does in terms of changes that are coming to our curriculum and to the standards. However, that being said, the purpose of this slide is to give you just a flavor of what it is you'd be doing over your 3 years, and also to highlight the two red areas there that you see on the slide related to PEDS/PEDS ER in the first year and PICU in the second year. Those are the only two times that we're in an institution outside of Ellis Medicine, and that's locally right here at Albany Medical Center, which is about 20 minutes down the road. When it comes to looking at the connections within the community and how the residency dovetails with it, I think we're pretty lucky. One of the aims of the ACGME, and actually one of the aims of the new standards coming out, is how closely your residency and your family health center aligns with meeting the needs of the community you're in. We've been lucky because this was already set for a number of years for us. We've been working at this for a while and have a very good foundation. So now it just becomes making sure that we tweak that as best we can and try to align exactly what we're doing in the FHC with what those needs are, again, out in the community, and what kind of experience we give you in doing so. In touching on the City Mission and Bethesda House, these are two separate homeless shelters here within Schenectady that we've worked with over a number of years, offering resident-run free clinics and liaison work with them in consultation and medical directing should the need arise. But each week, our residents are either going to City Mission or to Bethesda House, and we alternate in the evening at City Mission and during the daytime at Bethesda House. This is a beautiful picture of one of our migrant workers who is in Columbia County, New York. We've had a partnership with the health department there in Columbia County for years now. Have been sending residents down to do work through the migrant clinic initially. What that's moved into now has been a partnership where we go to the farms on days throughout the late summer to early fall to see patients and migrant workers who have made their way here from various countries to work our crop cycle at that time of year. And lastly, we have a very deep partnership with our school district. We work as medical directors for the Schenectady School District, which is approximately 10,000 students right now. And we offer both medical directing, consultation, resident-run and attended vaccination clinics, in addition to health screening and physicals, as well as sports clearance, and also policy guideline information for the school district to keep our kids safe and healthy. I've been working actively with both the school district as well as our local health department in potentially expanding our involvement in the school to include education for students and parents through multiple PTAs to get information out there on a number of topics that relate to their children's safety and their health. If you look at when formal quote-unquote teaching takes place, you're looking at lectures and didactics, and what we do here in our residency is we have those didactics on Tuesday afternoons. From 12:30 to 1:30 is typically for you as a class to meet with Dr. Ansel as the behavioral psychologist, and we do that as in cohorts. So the first years meet 1 week, second years, and then third years the following weeks. What we're looking to do is potentially take that fourth week in the block and utilize that for an open forum to talk about different issues that are affecting our residents or out there from a social issue standpoint, and bringing that to bear to have everybody involved and try and draw out the difference in opinions and the different takes and perspectives we have on this in a safe way, to allow people to see where we are all, even though we're all very different, where we might share some commonality. These lectures are also able to be live streamed to the other campuses, but there's other opportunities as well for teaching when you look at morning reports and grand rounds. Morning reports happen on both OB as well as medicine, and grand rounds is every Friday with the exception of the first Friday of the month, and I think they take off a couple of months over the summer. When it comes to procedures, I would just tell you, please don't shy away from your procedures, and always ask if there's an opportunity that we might be able to keep something in-house. The beautiful thing about having us be the only residence and the only residency in the institution is that when it comes to doing all of these things, you're the first one to get it. So don't shy away from it. You have a faculty who has a really good skill set in this, and other adjunct faculty and providers, teachers within the institution that are willing to bring you right up to speed with that as well. As I mentioned earlier, research is a requirement for us. There are 2 scholarly activities over the 3-year period. This is something that I know sometimes people can get a little stressed about if they don't have a history of, bench research and all of that. That's okay. There's many different types accepted. I don't want you to think that you're kind of keyholed into one thing that you can do. These have been case-based, they've been quality initiatives, they've been development of curriculum and different activities for the residency, and I will tell you that the institution does listen. We had some of our research actually change the way we look at cultures that came back from our pregnant patients for GBS. We've had our research go into looking at different ethnic groups having predisposition for diabetes that wasn't known or documented in the past. So don't look at this as a scary thing or a worrisome thing. It's something to keep you medically curious over your career, and that's what we're trying to instill in terms of habits. When it comes to resident benefits, I will tell you salary, I believe, is competitive to this area and other surrounding residency programs, so that when you look at year 1, your salary is up over $62,000 a year. In year 2, it's up over $65,000 a year, and in year 3, up over $67,000 a year. This is something that we're looking at and will continue to move with as the market dictates that. In that second box, you see professional developments and CME funds. There is CME money that you are allotted each year. Unfortunately, that does not roll over, but it's $750 in the first year, $1,000 in the second year, and $1,250 in the third year. When I think of professional development, I also think of your boards. So your certifying boards, not your steps. For your step exams, you can certainly use CME funds if you wish to, but for your professional certifying boards in both the osteopathic and allopathic realms of the American Osteopathic Board of Family Physicians or in the American Board of Family Medicine, we will pay for those boards. If you sign up for and take your boards and you're authorized to sit for those in your third year, we will pay for them. Professional memberships are paid for, so your AAFP, your AOA dues, ACOFP, that's taken care of by us. And in addition, your life support courses that you see there on the bottom. So we will certify you for ACLS as well as pediatric advanced life support, in addition to neonatal resuscitation provider courses, and lastly, the ALSO course, which is advanced life support in obstetrics. In the middle button there, you'll see moving expense. We offer a one-time relocation fee of $500. That's in your first year. You can't make a habit out of moving every year and having us pay you, unfortunately. I'm sorry. But that $500 relocation fee is paid out in that first year. Parking, we list there because there's no cost to parking, which is fantastic. You do get your lab coats when you get here, and I think one subsequently each year or thereafter. When it comes to an electronic or tech allowance, there's $200 in your first year that you can put towards anything you'd like in that way. So, for some people who come and say, oh, I need a new phone to upgrade to handle certain things, or I'd like to, put money towards a tablet because I find I can do my work faster that way on the AMR, we will allow something like that. And then travel stipends. So if you're working with us and let's say we're taking you to a conference because you're going to be recruiting with us or talking about the program or even speaking on research that you've done that's been accepted by that conference, then your travel is paid for. Outside of that, if you had interest in going to a conference on your own for your own continuing medical education, that would come out of CME funds. When you look at living in this area, this is interesting because everyone always says to me, well, of course you like this area because you grew up here. It's actually not true. I grew up in downstate New York, but I came up here because of the training, and I came up here because I was so in love with this program. And then I will tell you, I then continued to fall in love with the area and stayed put here. There's a lot going on around here. There's a number of wonderful schools, both public and private, and I'm talking about that at the elementary, middle, and high school level, as well as colleges and universities. There's a lot in the way of engineering in the Capital District and nanosciences and nanotechnology. So those are probably some of the bigger areas that you'll see here in Schenectady, even as it relates to other areas for growth in our neighboring Capital District and capital offices. Schenectady, however, though, as I mentioned, it was not an area that I knew very well before I came up here. And it was one of the things that I will tell you that I've really enjoyed is learning more and more about Schenectady and about the Capital District and about upstate New York. I've been fortunate. I've lived all over New York State, actually. But yet I will still tell you that even including the area that I grew up in, this is still my favorite part of New York that I've ever lived in. And the more I've been here, the more and more I tend to be falling in love with Schenectady. These are just some shots of downtown Schenectady. Businesses are coming back to this area. There's evidence, actually, if you look in the next slide, of growth along the river. This is the area down along the Mohawk Harbor and Mohawk River that has expanded over the last few years. And although I would say that there's a fair amount to do in and around Schenectady, this next slide is probably what also keeps me loving this area. And that would be the mountains on many sides of us, actually. So the Adirondacks to the north are just incredible. Catskills just to the south of us, Berkshires and Green Mountains off to the east side of us in Vermont and Massachusetts. There's so much to do in terms of outdoor adventures around here. I could say to you that, sometimes people, I think, get intimidated by the vastness of that wild Adirondacks, but even if you're just looking for small day hikes, little things to do in and around Schenectady, you'll certainly find them here for sure. And coming to the end here, I would tell you that one of the other things that I love about this area and why I will say that this is probably one of my favorite places to live is because of the fact that it is truly an all four seasons kind of place. The wintertime activities that you see here, the beauty of spring, as it pops through, what you can do here in summer, and of course, nobody would ever turn away a cider donut, I don't think. If you do, then I might have to question, me interviewing you here. Anyway, I would say to you that this is one of those places that if you love all four seasons, you will definitely find them very much defined here in this Schenectady and upstate New York area. But I think, when you look at why it is we do what we do, you can always find that if you know your why, then you can conquer any of the what's, how's, and how to jump past those barriers and all of those other things that try and distract you from your focus. This is a shot of last year's group who just graduated on their graduation night, and I can tell you this is the why for us. This is why we're here. And with that, I just want to wish you the best of luck. I really do truly look forward to meeting and speaking with you, and I hope this gave you a little something to think about and consider. Happy to answer any questions that come our way. Best of luck to you.